Hello, I am Christine Joy Duchelle, student nurse. So, every time we perform, we must review the client's medical record and perform the pain assessment and check the vital signs of the client and assess the client's ability to move and flexibility. And prior for performing the procedure, introduce yourself and verify the client's identity and ask how can you address the client. And before performing, we must close the curtain to provide the client privacy and safety, and we must explain what are we going to do and why it is necessary. And never forget to perform the hand washing techniques before and after the procedure because this will prevent the spread of microorganisms. And always observe the proper body mechanics and prepare the equipment that are we going to use to conserve time and energy. And it is important to remember that in placing the equipment, it should be placed according to which will be used first, and always ask the clients if they are comfortable in that position. First is apply a clean gloves to prevent the spread of microorganisms. And then remove all the linens. But make sure that your uniform don't touch the linens to avoid contamination. First is remove the pillowcase. And then, untuck all the linens and make sure to fold the soiled linen inward to prevent the secretion from scattering. And then place into the hamper. And then straighten the mattress. And then wipe it off with an antiseptic soap washcloth and dry it thoroughly. And then dispose the gloves. In changing the pillowcase, you must need to remove the pillowcase. But make sure that the pillowcase don't touch your uniform to avoid the contamination. And then place the pillow into a secure area. And then place the pillowcase into the hamper. And remove your gloves. And then before changing a new pillowcase, sanitize your hand first. And start putting in your gloves. And then place your pillowcase here. And locate the door or the end part of the pillow. And grasp the pillowcase. Place the pillow on the head part of the bed, and remember that the opening of the pillow should not face the door. So the first thing to do is to grab a bottom sheet and then locate a larger hem and place it under the edge of the bed. And then also locate the smaller hem and then spread the bottom sheet on the bed. And now the excess portion of the bottom of the sheet should be folded. And in placing the bottom sheet, the center fold of the sheet should be facing the center corner of the bed. And then fill the first layer first layer, I'm going to roll the second layer towards me. And then roll it again toward the center part of the bed. So now I'm going to grab the head portion of the bed and tuck the excess under the bed. Going to grab this and then let go of this part and then place this part here. So now I have a triangle. And then tuck the other triangle under the bed. And then let go of this. Tuck it under the bed. So now I'm going to place my waterproof underpad 18 inches below, which is made for mattress protection from urine damage. And I'm going to tuck it with a cotton draw sheet. After that, I'm going to place my top sheet now. Locate the larger hem and then place it on the head of the part of the bed. And locate also the smaller hem. Spread across the bed. And then fold the excess linen. And then peel the first layer. And then roll the second layer towards me. And then roll it again to the center part of the bed because this also used to cover the opposite side of the bed. So now I'm going to proceed to the other side of the bed with the same procedure. First thing to do is to grab a bath blanket to cover the patient. And encourage the patient to participate. This promotes the independence to the patient. Next is remove the top linen by rolling inwards and towards the edge of this mattress. This prevents the secretion from scattering. then dispose the soiled linen into the hamper. Next thing we should do is to instruct the patient to move closer or help the patient to move closer to you by 3 sections: the upper, the middle, and the lower section. And then move the patient into a lateral position. And make sure that the patient is not exposed. Adjust the pillow. And next is untuck the bottom linen, roll it inward towards the client, and tuck it as close as possible to the patient. Next is place a clean cotton sheet on the bed, unfold and tuck it in the place. And then unfold the sheet closer to the patient. And then place the rubber sheet under the mattress for protection of the mattress from urine. After that, we're going to place a cotton sheet and tuck it under the mattress. And then next is we're going to reposition the patient at the center of the bed. This prepare the patient to move to the opposite side of the bed. And move again closer to you by doing the 3 sections. Then move again into a lateral position. One, two, three. The next is remove the said linen by rolling inward towards the bottom of the bed. then dispose into the hamper and make sure that the linen don't touch your uniform. Remove gloves because we don't want to contaminate the new linen. Next is we're going to pull the bottom sheet into the place and tuck it under the mattress. And then pull the cotton sheet. And tuck it under the mattress. After that, we're going to assist the patient to move to the center part of the bed and to his back. This provides comfort to the patient. And then remove the bath blanket. And dispose to the hamper. Covering the patient promote warmth and safety. Next is we're going to place the blanket to the patient and tuck it under the mattress. Meet the corner, it secure the linen when occupied. After that, we're going to make a two pleat so that the movement of the client feet is not restricted. Next is we're going to change the pillowcase. Next is change the pillowcase. And place the new pillow under the head of the patient.